Today I'd like to show you some acupuncture points on the neck to help improve the blood and lymph circulation to your eyes. One of the ophthalmologists showed on YouTube how those points can help reduce the eye pressure. And from my 26 years of experiences, I think eye pressure is just one side related with glaucoma. There is another kind of glaucoma that eye pressure is not going up, but the circulation to your eyes is compromised by neck tightness or any blood circulation problem, lymph circulation problems, or nerve problems. And specifically for those type of glaucoma, because the eye pressure does not go up, so it's not easily detected. And if you combining acupuncture points with the acupressure on the neck and eye area, then you can improve the whole energy flow to your eyes, retina, optic nerves. So the first point called Tian Chuang, it means heaven window, and it's also called small intestine 16. And if you want to locate this point, you first need to find Adam's apple, and at the same level you go to the side, and then you see this muscle called sternocleidomastoides muscle. And there is two heads of this muscle. One is called sternal heads, the other called clavicle head. And posterior to this posterior of this muscle, the edge of this muscle, and at the same level of Adam's apple, then you can find this point. It's called heaven window, small intestine 16. So when you press that, when you lie down, you can feel the sensation going down to your arm, to your neck, and it can lower your blood pressure and also benefits your throat. So it's good to lie down to press those points, because if you have low blood pressure, you can drop your blood pressure even lower. And so that's one spot. The other spot is called large intestine 18. Again, it's at the same level of Adam's apple, but it's located between these two heads. You see this muscle, sternocleidomastoides, and there's two heads. I mentioned the sternal head and the clavicular head. So between these two heads, at the same level of Adam's apple, and you see the point here, and this is the large intestine 18. You can press that to clear up your throat, to relax your shoulder and neck muscle. And going posterior, and this clavicular head, posterior this clavicular head, and that's another point we just mentioned called small intestine 16. It's the heaven window. So this 2 points, when you press, and you kind of bring energy to your eyes, retina. And the other point's called triple worm 17. So it's behind your earlobe, and if you find the mastoid process and this angle of the mandible, and between the mastoid and the angle of the mandible, you draw a line in the midline just behind the earlobe. There is a depression, and press that, you can feel the sensation going down to your lower jaw and along your neck. So that's another point, can improve the energy flow to your eyes, retina, and optic nerves. And not only that, this point, triple worm 17, can also be used to treat tinnitus, swelling of the neck. The tinnitus is very popular nowadays because people use earphone a lot and they talk on the cell phone. That all can inflame the nerves in the inner ear. And one last point called gallbladder 20, which I showed before. So if you find the mastoid process here and go posterior, you find upper portion of this sternocleidomastoideus muscle and the trapezius. Between these two muscles, there is a depression here. When you press that, you can feel the sensation go up to your head, and you can instantly relax the whole neck muscle. And that's very important to relax this muscle so that the blood vessel can be dilated and bring more oxygen and nutrients to your eyes.